antibiotics that is safe in pregnancy, they can use it for UTI, they can use it for STD. Okay. And another fact you need to remember is that every UTI in pregnant women is a complicated UTI. Every UTI in pregnant women is a complicated UTI. So this is the mnemonic. I call it MAF, MACF, MACF. So you can say MACF is safe in pregnancy with UTI and STD. So what is MAF? M is macrobate. Macrobate. So another name for macrobate is nitrofurantoin. So macrobate is safe in pregnancy, in especially in the first and the second trimester. Is safe in pregnancy, especially in the first and the second trimester. But we try to avoid microbate, which is nitrofurantoin, in the third trimester because it increases the risk of hyperbilirubin, high bilirubin. So macrobate, which is nitrofurantoin, is safe in first and second trimester. So it's safe in first and second trimester. And in third trimester, we say that it can cause high bilirubin. Okay. Then another one that is more safer because it's a newer guideline is fosomycin. So you can that fosomycin is my F. Okay. Fosomycin is F. So fosomycin is more newer for the new guideline because they said it's more safer than macrobate because macrobate is nitrofurantoin. So please remember that. And another thing to remember is that you can give them amoxicillin or augmentin. Both are safe in pregnancy, and that is our A. Amoxicillin or augmentin. Another one is C. C is cephalosporin. I have talked so much on cephalosporin. I have video on cephalosporin. I say that cephalosporin is divided into five generations: first, second, third, fourth, fifth. And I have a video on that. You can always watch it. So cephalosporin, especially Keflex, that is used for UTI, but we mostly use it in third trimester. Some people use some mnemonics like macrobate is first and second trimester. You want to make the baby stay, which is M. Make the baby stay. Some people use mnemonics like that. M, you want to make the baby stay because you want the baby to stay in the first and the second trimester. But as soon as it's third trimester, you want to kick the baby out. So care for kick the baby out. You want to kick the baby out. So that is why they use Keflex for the third generation for the third trimester. So, but if a patient, we have talked about that, if a patient is allergic to, let's say they are allergic to amoxicillin, of course, they are going to be allergic. There is what we call cross sensitivity. I know it might be like 10%, but just as a new provider, you want to practice safe. As a novice, you want to perfect in your practice. It's always recommended that you should assume that, I know that 10% is not a lot, but then if they are allergic to amoxicillin, they should also not you should use augmentin or cephalosporin with caution. So that is why we use azithromycin. So azithromycin is also safe in pregnancy, and at this point there is no and research anywhere that have said that azithromycin um, should not be used in pregnancy. Okay. Then we have medications to avoid in pregnancy, very high yield. And these are the medication. I will still bring it out more clearer. Tetracycline. Tetracycline should not be used in pregnancy because it causes staining of the teeth, except if the benefit outweighs the risk. Okay. Again, except if the benefit outweighs the risk. So what do I mean by that? Like in the cases of Rocky Mountain spotted fever. Rocky Mountain spotted fever, we said it can cause a life-threatening situation. So in situations like that, is a more benefit. So the benefit outweighs the risk. The risk is just the staining of the teeth, the photosensitivity. So at that point, doxycycline can be given. So another thing is quinolones. Quinolones can cause the tendon rupture, Achilles tendon rupture. So of course, we don't give it in pregnancy. Also, sulfonamides, which is like your Bactrim. So Bactrim, especially you should avoid Bactrim in first trimester and, nearing the full term, like when they're about to have the baby. You need to avoid it because Bactrim can cause cleft lip and cleft palate. It can also cause jaundice. Okay, it can also even cause folate issues. Okay, it can also cause folate issue, and also like I said, um macrobade, macrobrade. Do not give it at the third trimester. We have mentioned that. Do not give it at third trimester because macrobade can also cause um high bilirubin. So for more emphasis of what I went through, you can also say it like this: antibiotics to avoid, tetracycline because of the teeth, staining of the teeth, um fluoroquinolones, it can cause cartilage damage, aminoglycoside, it can cause ototoxicity, Bactrim, I also mentioned that. Okay, and also remember uh other memory tricks, medications they can take, antibiotics they can take. You can either use this one I use already, MACF, MACF. If you don't want to use MACF, you can also use this one. You can just say pregnant women can take Pecan, Pecman. So P is penicillin, so they can take penicillin. They can take azithromycin, which is your macrolide. Also note the other names because in the exam they may call it something else. For example, this one can be called macrolides. Then cephalosporin example they can tell you is Keflex, so it's still under the 10. Uh-huh. Metronidazole, amoxicillin, nitrofurantoin, which is your macrobade. Macrobade is different from macrolide. So these are not the same. Then also our fusemycin is here. So I need to include fusemycin is very, very important. I need to bring it here. But you know, mnemonics is whatever you can use to remember. So, fusemycin is your better alternative to macrobade. Is better alternative to macrobade. Better alternative to macrobade. So please know the medications that you can use in pregnancy, especially for UTI. And because it's a complicated condition, UTI is always have to be given more than 7